You can't even touch my knee. How is online ACL knee rehab supposed to work? And that's a fair question, because when most people picture physical therapy, they picture hands-on treatment, stretching, massage, someone bending their knee for them. But here's the truth. Successful ACL and knee recovery isn't about someone passively stretching your leg. It's not about getting 10 minutes of massage, and it's not watching you do 3 sets of 10 reps of the same exercises over and over again. It's about the plan and whether or not that plan is actually moving you forward, because that's where most people fall short. Now, let me be clear. There are some fantastic in-person physical therapists out there that specialize in ACL and knee rehab. But for a lot of people, this is what it looks like. You go 2 to 3 times a week. Your therapist is double or triple booked. You spend 10 minutes with them, and then you're handed off to do the same exercises you've been doing for weeks. And hey, some people are totally fine with that. If your goal is just walking comfortably or doing stairs, that may be enough. But if you want to ski again, play sports, run, hike, and play with your kids without hesitation, that's where things often fall apart. Because here's what's usually missing. Important metrics don't get measured. Strength deficits go untested. Foundational milestones get skipped. And people end up guessing their way through their recovery. They feel stuck. They're not sure if it's normal. So they wait and they just give it time. But before you know it, months go by and they aren't where they need to be. And that's when they start searching online, and when many people find me. So what actually is online ACL and knee coaching? It's removing the stuff that feels important and doubling down on what actually drives outcomes. The fact that I can't physically touch your knee actually forces us to focus on what truly matters. So instead of 15 minutes of passive, hands-on treatment, we focus on structured programming, weekly progressions, objective testing, movement analysis, clear weekly goals, ongoing communication, recovery, and accountability. We use video analysis to break down exercise technique. We measure strength properly, not guess. We earn progressions, not assume them from a protocol. You get clear, evolving plan that changes week to week based on how you're responding. Because ACL and knee rehab isn't a 3 times a week problem. It's a daily process, and online coaching matches that. Now let's address the big concerns, because I know what you're thinking. You can't touch my knee, so how can you even assess me? Here's the thing. ACL and knee rehab decisions aren't based on how something feels to the therapist's hands. They're based on measurable data, range of motion, strength, movement quality, load tolerance. And through structured testing and detailed video analysis, I can see exactly where you're at. For example, I can't tell you how many people come to me saying, my therapist told me that I have full knee extension range of motion. And then when we actually assess it, there's still a deficit. Or we test quad strength, and it's nowhere near where it needs to be. Or we find compensations that were never identified. You don't need someone physically touching your knee to assess progress. You need the right tests and someone who knows what to look for. Here's what surprises most people. I almost always find compensations during client intakes, shifting stress away from the surgical knee, avoiding loading their quad, and using the hip to protect the knee. Or maybe these movements look okay at a glance, but those compensations limit how much the knee is actually being challenged. People are working hard doing exercises like squats and lunges, so their effort feels like progress, but it's leaving results on the table. And here's the reality. If you're seeing your therapist for 5 to 10 minutes because they're double booked, there's only so much detailed feedback that can actually happen. Online, I can see videos from your actual workouts, and you get breakdowns consistently, not just during a 30-minute appointment 2 times a week. That's how we clean up movement issues early before they become habits. Hands-on work can feel good. It can temporarily reduce pain, but it's not what restores range of motion long-term. And I'm not anti-manual therapy, but ACL and knee injuries are an active problem, and they require active solutions, not passive ones. Most of my online clients come to me still missing range of motion despite getting hands-on treatment for months and months. And once we identify the root cause, we restore what felt impossible. So maybe you just tore your ACL or injured your knee. You're overwhelmed. You want to do this right the first time. Or maybe you're trying to avoid surgery altogether. Or maybe you're 6, 8, 12 months post-surgery. You've been going to local physical therapy, but deep down, you're not confident in the plan. You're stuck, frustrated, and working hard, but not moving forward. Maybe you've been cleared, but the confidence isn't there. Maybe you've been piecing things together from YouTube and Instagram, saving exercises, trying random add-ons, tips, and tricks, and you're putting in the work, but standing still. You're tired of guessing. Maybe you see others progressing and you think, what am I doing wrong? Is this just my new normal? If any of that hit home, that's exactly who online coaching is built for. And online coaching isn't a magic pill, but if you're looking for a clear, structured plan, someone who specializes in ACL and knee rehab, not 10 different injuries a day, specific milestones to hit, real feedback so your efforts actually count, and a roadmap back to an active lifestyle, not hope, not guesswork, a clear path forwards. Now, online rehab isn't for everyone. It works incredibly well if you meet these 4 criteria. Number 1, you're coachable and you can follow a plan without constantly overriding it with random internet advice. Number 2, if you communicate openly and frequently, because online coaching only works if you're honest about what's happening. Workouts, pain, setbacks, missed sessions, doubts, wins. What isn't communicated turns into a guessing game, and guessing has no place in ACL and knee rehab. Number 3, you're fully committed. 1 foot in, 1 foot out does not work. If I'm putting in the time and the effort to guide you, are you willing to show up for yourself? It's a two-way street. And lastly, you're a hard worker. The perfect plan means nothing without effort. Structure doesn't replace work. You need both. Flavio came to me at 6 months after surgery. His recovery had completely stalled. He was still missing range of motion. His knee felt stiff, and he genuinely started believing maybe this is just how it's going to be. That quiet fear that your knee will never feel normal again. That was him. So we got structured. We attacked the mobility deficits. We rebuilt strength with actual progression, not random exercises. Through his consistency and his dedication, 1 year after surgery, Flavio was back on the slopes safely and confidently. Marianne's story is different. She originally tore her ACL back in high school. So when she tore the other one more recently, she knew exactly how hard the process could be. But this time was different. She runs a ranch. She halters colts. She rides horses. She performs at shows. Her life is physical and she couldn't afford to be sidelined for a year. So we built a plan around her lifestyle. She wanted the schedule flexibility without being tied to clinic visits. 4 months into online coaching and she's back to riding, back to shows, and back to managing her ranch. And she did it without surgery. And then there's Gene, 8 months post ACL surgery, and he was still going to physical therapy locally, still dealing with graft site pain, quad weakness, missing range of motion. He kept hearing, trust the process, but no one could actually explain what that process actually was. So he was starting to wonder, am I ever going to play basketball again? So we got specific with an online assessment. We dialed in on what he needed, building his foundation, and then a structured return to the court. And now he's back to playing confidently. Different people, different starting points, same foundation. Structure, progression, communication, and effort. Online ACL and knee rehab isn't about replacing hands-on care. It's about elevating the pieces that actually determine your outcome. So if you're stuck, or you want to do this right the first time, online coaching might not just be an option, it might be exactly what you've been looking for. And if this felt like I was describing you, you're not crazy. You're not behind. You just need the right structure. If you're ready to take action with a clear path forward, use the link in the video description to book a free call with me. We'll identify the bottleneck in your recovery and develop a game plan to get you back to what you love doing with confidence. I'll see you on the next video.